my name is Nick Pickett, and today I'm going to be talking about the movie Awakenings. It stars Robin Williams, the late Robin Williams, and Robert De Niro. It's a movie that I'd seen a long time ago and hadn't seen in a while, and decided to go ahead and watch it again since the recent passing of Robin Williams, who does a great job in the movie. The story is about a physician that finds work in the late 60s. He had been a researcher. He had not spent time in the clinical practice for very long. So he had to start treating patients again. He had not done that in quite a while, and that was Robin Williams' character. And he just started to come across a lot of really interesting people. It was a mental institution that he worked in, and he's seen a lot of different diagnoses. But there was one particular form of patients that he was seeing that he couldn't quite put his finger on what was wrong with them. Come to find out that he basically deduced that they had an advanced, very severe form of Parkinson's, basically, it caused a lot of muscle rigidity, and where the patients could still have reflexes, because whenever he tossed the ball to them, they would catch it. So he started researching that very thoroughly, found this new medicine that was coming out at that time called L-Dopa, which they do use for treat Parkinson's nowadays. And after manipulating the doses, upping the doses, he finally found a level that reached what would work to basically awaken these patients. All of them regained complete full functioning. They continued to move freely and function normally like they would have before. It was what he had found after he was researching was that they had a very severe form of encephalitis at the same age roughly, and so that was what he found was the common diagnosis or ailment that basically caused a lot of these people the problem that they had. All the patients were doing fine, and then Robert De Niro's character, which is the one he originally started the treatment on to find the cure, he started to relapse and started to get a lot of real spastic tremors and shakes, and eventually came to a point where no matter how much Robin Williams upped or lowered the dose and manipulated the dose, he still couldn't quite get him back to the same functioning he had him before. And eventually all the patients reverted back to their same comatose state. It was a very sad movie. The fact that these people were functioning perfectly well with this dose, and that they, went back with one of the themes in the movie, though, was that a lot of these people had missed quite a bit of their lives. So really, what kind of quality of life did they have? I think one patient had his wife had left him, and his son had been killed, and all these different things, horrible things that when he did finally awakened, what did he awaken to? That basically there was no life for him anyway. So he really kind of hinted towards he would rather have went back. One of the themes that I took away from the movie was, a lot of times in healthcare we think about how costly a lot of these treatments are, and sometimes, as bad as it is, a lot of us, weigh that cost when really we should be doing whatever we can to improve some of his quality of life. I know that in the movie, Robin Williams pitched the money the cost of the L-Dopa for all the patients was going to be like $12,000 a month, which in 1960 was a lot of money. And the director basically kind of balked at that until like the nursing staff and all the janitorial staff and all the orderlies started like putting their paychecks down in front of the director, and he realized how much it meant to the rest of the staff. And then he finally pitched it to the board, which finally released, a lot of the money. So, that was one thing that you kind of see that, sometimes we need to put cost aside and just do what's best for the patients. Which, you see it a lot, but there's still times where that kind of hinders treatment for a while because they're weighing options, and we really shouldn't be doing that. Another theme from the movie that I took away was patient advocacy. I think it's very important that you continue to try to strive to do what's best for the patient, even though you get doors slammed in your face and you get, a lot of people telling you no. That was the one thing that Robin Williams' character in this movie was very, very adamant about. He pushed for it a lot. He continued to not take no for an answer, and he continued to push and push and push until he had what he wanted was the end result. How this movie could have been made a little bit better, I don't really think it could have improved much. It was filmed very well and very believable. Some of the medicine in that time was still in its infancy. A lot of the other psychiatric patients had a lot of wild diagnoses that you could see portrayed very well by a lot of the actors. The family interactions. Robert De Niro's character, his mother, was his mother continued to see him while he was in the psychiatric ward, and she would continually bathe him and comb his hair and take care of him, and she was ultimately the one that Robin Williams got consent to go ahead, and he was the first one that he treated with the L-Dopa to see if it would work. He was very frank about it. He was very honest and said he didn't know what it would be. He didn't know if there would be any side effects. It was obviously going to be a trial. The family interactions was pretty well. A lot of the patients, when they awoke from their comatose states, had a lot of family members come and visit them and see them. There was good family interactions. The things that I'm going to take away from this movie for my practice are just, like I stated before, patient advocacy. I just think it's very important that we continue to push what's best for the patients. Sometimes it might be a new experimental procedure or something. As long as we weigh all the options and stuff, it's important that we continue to ask physicians for those things. And the other would be what was covered earlier, the cost. A lot of times that we decide, I see it sometimes where I work, where a patient's very risky, the surgery would be very, very risky, high risk, and therefore a lot of times they're justifying the costs of all the things that would be involved in such a risky surgery, and therefore maybe a patient might not receive that treatment because of that. And therefore I think that a lot of times we should take cost out of things if it's going to benefit the patient. Obviously if it's high risk, we don't want to try to attempt it unless we really think we're going to be pretty successful with it. But I think it's important to take cost out of the equation and just do what's best for the patient. A lot of times you see patients that get discharged and the medications that they need to be on, a lot of times insurance won't pay for them, and it seems like there needs to be a better way to figure out what's best for them. If we put them on subpar antibiotics to go home, then it's going to be a longer course of recover and healing. Then we didn't really do them any good if we would have sent them home on antibiotics that were more effective and would have took less time to treat the patient. So overall, it's a great movie, very good, very touching. I really suggest anybody would like to watch it. It was just a really good performance. Robin Williams is a very good physician. He portrays a very good physician that's very caring of his patients. Just a great film. Thank you.